Hi students, welcome to VHSA classes, and today we are going to talk about nursing process. And in this chapter we are going to talk about critical thinking and nursing process. And in today's lecture we are going to talk about critical thinking. So let's discuss what we are going to talk about in this particular chapter. So here there is everything about the nursing process, the critical thinking, nursing process, purposes of nursing process, what is the objectives, what is the assessment, and all the we can say steps of nursing process we will explain in this particular chapter series. So in today's chapter we are going to talk about critical thinking and nursing judgment. Okay, so this is the first step of nursing process, that is the critical thinking. So let's talk about the introduction of this. Like, critical thinking like a nurse was first introduced in 2006 by the Dr. Christine Tanner. And to think like a nurse, critical thinking and the clinical reasoning must be known and well defined. And there are concepts of critical thinking and clinical reasoning is well used by the nursing during the time of patient care. So what is critical thinking? Let's discuss the definitions of critical thinking. The first definition is critical thinking is the process of deliberate high levels of thinking to define a problem, analyze the evidence-based practice in the patient care, and it make alternatives in the delivery of nursing care. So what is critical thinking here? We have to find out, we have to analyze each and every solution available, and on the basis of that analysis evidence we have to find out the best option available. Next is critical thinking is a continuous process characterized by open-mindedness, continual inquiry, perseverance combined with a willingness to look at each unique patient situation and determine which identified assumptions are true and relevant. So this is another definition given by Hefner and Judy in 2008. So basically critical thinking is a continuous process. We are where we are observing the patient with open mind, we are inquiring all the situations, and with that we are working towards the patient to make sure that we are analyzing each and every unique situation of patient, and on the basis of those unique situations we are making the decisions for the patient. And according to Victor Camille in 2013, clinical reasoning is often defined as the application of critical thinking to the clinical situation. So reasoning is also like when we are using critical thinking, okay, higher level of thinking in our nursing practice, that is clinical reasoning. So these are all the definitions of critical thinking. Basically critical thinking is higher level of thinking where we are analyzing each and every situation deeply and we are finding out the best solution for the unique situation. So what are the attitudes for clinical critical thinking? Okay, the first one is intellectual courage. Okay, so nurse should have a intellectual courage. It is the ability or willingness to listen to the patient and evaluate the ideas, beliefs, and whatever the patient is saying, we have to evaluate that so that we can understand their ideas, we can understand their beliefs. So that is the intellectual courage. Next is empathy. Empathy literally means understanding the patient's perspective here. Okay, so as we are talking, like, we have to be empathetic with the patient, we have to try to understand what is the patient's perspective related to a particular situation. Another attitude here is orderly interpretation. Okay, so it is like orderly interpretation is like systemic data collection of the patient. Okay, we are looking with to the data and we are finding some patterns in the data, and on the basis of those patterns we are organizing the data to gain some findings to analyze the situation of the patient or the, we can say, the problem here. Next is critical judgment. So here we have to be open minded while we are assessing the patient. We do not have to make clueless assumptions. Okay, we have to use critical judgment. First we have to identify the problem, and on the basis of we can make the assumptions. So these are the attitude for critical thinking. First one is a nurse should have the intellectual courage. She should be empathetic. She should orderly interpret the data, and she should have a critical judgment. Other than that, there is inference. Okay, so whatever the patient is telling us, whatever the data we are looking at, we have to try and find out some relationship, some significant in that. Okay, and that is inference. We have to look for the meaning and look for the significance in the patient's data. That is inference. Next is integrity. So integrity is how we are being honest and having a strong morals and principles. So we should have a strong morals, we should have honesty, and we while we are talking and while we are conversing with the patient. Next attitude is explanation. Supports the finding and conclusions with evidence-based studies. Okay, as I told you, we don't have to make random assumptions. Whatever we will assume, that should be based on proper data interpretations. We are looking critically towards each and every situation, and on the basis of that we are making the assumption, and whatever the assumption we are making, that should be well supported by the evidence-based studies. And next is self-regulations. So it reflects your own experiences. Okay, so how you can improve your performance, what things are there which need improvement, and how you want to be successful here. That is self-regulation, and it is also a positive attitude in critical thinking, where you are analyzing yourself for the experiences or to improvement of yourself. So, what are the skills for critical thinking? What skills you should have for the critical thinking? So there are following things. One is inductive, deductive, valid inferences, critical analysis, clarifying the concepts, and assumption recognition. So, what is inductive? So, basically, inductive is like we have to look at the various specific phenomena, and we have to make a generalized, we can say, the result on that. Okay, specific to generalize, like we are looking at small details, and we are making a generalized observation on the basis of that. That is inductive critical thinking. Okay, small things we are keeping in our mind, and on the evaluation, or we can say interpretation of those, we are leading to a generalized result. That is inductive critical thinking. After that comes your deductive critical thinking. So this is basically opposite. From a generalized phenomena, we are moving towards the specific phenomena. Okay, for example, we have a bigger problems, but we want to know what are the various causes for that. So that is deductive. Here we have a generalized problem, and we are trying to find out the specific things for that, specific areas for that. That is deductive. Okay, so inductive means specific to generalized, and deductive means generalized to specific. Okay, so these skills should be with the nurse in for the critical thinking. Next is valid inferences. As I told you, we don't have to make random judgments, random assumptions. First of all, we will analyze whatever the patient is doing, whatever the patient is telling, and on the basis of that, we should make the assumptions, and all the assumptions should be evidence based. Okay, so valid inferences should be there, valid results should be there, and the results should be backed by evidences. Next is critical analysis. Okay, critical analysis is basically where we are analyzing each and every part of that situation. That is critical analysis, where we are trying to find out various reasons, various situations, and how unique the situation is. We are making sure, and on the basis of that, we are analyzing the situation. That is critical analysis. Next is clarifying the concept. So here we have to clarify various concepts, various we can say things that we are finding out at the time of critical thinking. We have to clarify those concepts. Okay, we don't have to make the assumption, we have to clarify the concept, why something is happening, and what's the reason for that, and what's the evidence with you for that. Next is assumption recognition. We will make the assumption like, because of this particular thing this happened, or because of this particular specific thing this happened, but there should be proper recognition of that assumption. There should be proper, we can say, evidence for that assumption. Okay, whatever the evidence is, assumptions we are making, that should be backed up by the evidence, or we can say backed up by some inferences results. So that is assumption recognitions. So these are the skills that should have a that should be with a nurse, that will help in the critical thinking: inductive, deductive, valid inferences, critical analysis, clarifying the concepts and assumption recognitions. So there are different levels of critical thinking in nursing. So these levels are level 1, level 2 and level 3. Level 1 is basic critical thinking, level 2 is complex critical thinking and level 3 is commitment. So students, let's discuss this. Okay. So levels of critical thinking in nursing. First one is level 1 and this is the basic critical thinking. So what happens at this level? The thinking is concrete and based on the set of rules or principles. Okay, so this is the basic level of thinking where we are following the rules, basic rules, whatever the set rules of the hospital, like we have to check for this kind of input, we have to check for the output, we have to check for these kind of sign and symptoms, and on the basis of that we can judge that the patient is having some illness or patient is requiring something. That is a basic level of critical thinking. Next comes the complex critical thinking. So complex critical thinking, the thinkers begin to segregate themselves from the experts. They analyze and examine choices more independently. Okay, so here we are making sure that we are analyzing all the choices. We are looking at them like we are segregating them. What choice is better? What are the advantages of that? What are the disadvantages of that? Okay, we are analyzing each and every choice. We are analyzing each and every situation. That is complex critical thinking. And the last level of is commitment. At the commitment level, nurses choose an action or belief based on the available alternatives and support it. So after doing these kinds of critical thinking, there comes the commitment. Okay, you have done all the, we can say, interpretations of data, you have checked all the data, all the evidences, and all the basis of that, on the basis of that you have chosen an action and you believe that it is the best alternative and you support it. That is the commitment. Okay, whatever you have selected with all the thinking, that is the best, that is the third level, that is commitment to that particular thought or assumption. So these are three levels of thinking: 1, 2 and 3: basic, complex and commitment. Okay, so critical thinking competences, what kind of competences you should have? First one is general critical thinking. And what should you have? There should be scientific methods for that, problem solving and decision making. Next is specific critical thinking, competences in clinical healthcare, diagnostic reasoning, clinical inferences and clinical decision making is the part of this. And the specific critical thinking, it includes the nursing process. So in general critical thinking, we are using scientific methods, we are assessing the problem, and we are, after assessing the problem, we are making decision and we are selecting some choices for the patient. And specific critical thinking, here we are first of all diagnostic reasoning. We are trying to find out what is the problem and what is the cause of the problem. And after that, clinical inferences. Okay, we are using clinical evidences, researches, results, lab results for that. And after that, on the basis of all those clinical results, we are making the clinical decision. And the last one is specific critical thinking. Here we are using the nursing process. And as you know, nursing process includes 5 steps: assessment, diagnosis, goals, planning, implementation and evaluation. So the general critical thinking, scientific method, systemic process, where we have to use some steps to solve the problems. Next is problem solving, process of defining a problem and determining its cause, identifying and prioritizing and selecting alternative solution for that. And third one comes the decision making, where we are making decision on the basis of the problem, and here the main focus is on the solution of that problem, or we can say problem resolution. So what are the steps of scientific method? How we can do the scientific reasoning or the critical thinking? The first step here in critical thinking is identification of problem. We have to identify the problem. What is the problem here? Next is data collection. Okay, we will try to collect the data. Here we can ask the patient, we can take the history, we can take the lab values, all those things we will use for data collection. Next is formulation of questions or hypothesis. Okay, so here we will generate a hypothesis, we will formulate a question, and we will test that hypothesis. We can do some trials, we can find out some we can do some researches, and we can test that hypothesis, that whatever, are we accepting that hypothesis or rejecting that hypothesis. And next is evaluating the results of the study. Okay, this is scientific. So whatever we have done here, whatever the research we have conducted here, we have to evaluate the results of that study. Okay, so this is the scientific method of problem solving, or we can say as critical thinking. So what is the steps of problem solving? How in the critical thinking we can solve a problem? First of all, identify and define the problem. Okay, so we can solve a problem if we know that it is a problem. The first step is to identify and to define the problem. After that, to analyze the problem. Now we have to analyze the problem, what kind of problem it is, what is the extent of that problem, okay, and so on. What is the, we can say, root cause of that problem. Next comes the development of solutions. Okay, for every problem there is not only a single solution. Okay, there might be many solutions for that problem. Solution 1, solution 2, solution 3, there might be many solutions for that problem. So that is the development of solution. At this stage we have to analyze. After analyze, we have to find out and make a list of all the available solutions we have. Next comes the fourth solution. Now we have to analyze these all solutions. Like, this is the solution 1, what are the advantages, what are the disadvantages, and we have to analyze, and we have to see what is the best solution for the patient. And after that we have to implement that solution. Okay, and after implementation, as we know, we have to evaluate the solution, whether that particular solution was a good choice for the patient or not. That is the evaluation. Other than that, after that comes again identify the problem. If that was not the good solution, we will again identify the problem, analyze the problem, make another solutions, and implement those solutions and evaluate those solutions. So this is the problem solving, and we can say the process of problem solving. So next one was the specific critical thinking competences in healthcare. First one is the diagnostic reasoning. So what is a diagnostic reasoning? It is the process of analytical process for determining patient's health problem. As we all know, diagnosis, nursing diagnosis, clinical diagnosis. Here we find out the problem. What is the problem? Next comes the clinical inference. As we all know, here we collect the evidence, here we collect the data. That is clinical inference. Inference means results. Okay, so we can use previous results, previous evidences, or the newer evidences, and that is clinical inference. And clinical decision making. And with these evidences, with these results, we can focus on the problem solving, and we can select a proper appropriate solution from the problem, and that will be how we will select the solution here, on the basis of these inferences, on the basis of these evidences. And the special critical thinking competency in nursing. The special critical thinking competency is specialized nursing skills, and basically it is the, we can say, nursing process, where we are using specific critical thinking in day-to-day life for the betterment of the patient. That is nursing process, and it is a goal-directed patient-centered care. Okay, so nursing process, in nursing process we make nursing care plans for the patient in hospital, and every nursing care plan is unique as per the patient's needs. Okay, so that is specific critical thinking competence in nursing, and nursing process is a part of this. Okay, so that's why nursing process and critical thinking are together in this particular chapter, because it is the part of specialized or specific critical thinking in nursing. Thank you so much.